Hello, this is Dr. Serrano again, your friendly nephrologist and vascular interventionist, talking about kidney disease. How do we control kidney health? Uh, the best way to do it is with three different things. Number one, controlling your blood pressure. Number two, controlling your blood sugar or your diabetes. And number three, controlling the amount of protein in your urine. And briefly, how do we do these things? Well, number one, to control your blood pressure, you've got to take the right medications. So you must go to your doctor and get certain medications that reduce the blood pressure. It is widely known that it really doesn't matter how you reduce your blood pressure or with what medication you utilize in reducing blood pressure. As long as you can reduce it, that is sufficient. Of course, we're not going to reduce it with some aberrant way that is going to harm us, but what I'm trying to communicate is that if we can use medications that can do the job, that is sufficient. If you decide not to utilize medications, the first thing you should do is reduce your salt intake, even before considering medications. So that includes not eating at fast foods, restaurants which have a lot of preservatives, a lot of sodium-containing foods, like French fries and everything that you see at these very popular fast food restaurants. And you shouldn't eat much from cans and boxes because there's a lot of salt in cans and boxes. You should try to eat a lot of leafy green vegetables, and if you can see it on the counter and pick at it, and when you're going to the supermarket, generally those foods have low sodium and they're good for you. So diet is important. And lastly, exercise. Exercise is very important. It reduces your blood pressure by various methods. Not only does exercise reduce your blood pressure from lowering your heart rate in general after you exercise, that's your resting heart rate, but it also helps you to lose weight if you do it properly. And we know that losing weight also reduces blood pressure. So those are the things you can do to reduce that number one factor, blood pressure, and helping out the kidney in that fashion. The second way you can help out your kidney is by controlling your blood sugar. We know what hemoglobin A1C is, and it is very important to keep a hemoglobin A1C about 6.5 or below, so that the sugar doesn't attack your kidneys the way it does when it is out of control. We know how to reduce blood sugar. If you're diabetic, you take the appropriate medications prescribed by your doctor, and we eat the right foods, not very high in carbohydrates. We reduce the amount of food we eat so that we are eating smaller portions with less calories, and that'll control not only your blood glucose, but also your weight. And in reducing weight, then we are also controlling your blood sugar and your diabetes a lot better. So if we can do those things, take the right medications for our blood sugar, eat right, and exercise, losing weight at the same time, then we've got that second component under control, which is controlling your blood sugar, and in that fashion, helping your kidneys. And the third way to help your kidneys is to reduce the protein in your urine. So proteinuria is very common with diabetics, and it is a sign that the kidney is sick. And the way you can reduce the protein in your urine, or proteinuria, is by taking medications, two of which are an ACE inhibitor and an ARB. And both of these medications are prescribed by a doctor, and what they do is that they not only reduce the protein in your urine, but they also help out the blood pressure. And they also have other ways of helping out the kidney by helping the kidney to excrete factors that will help the kidney survive and help it not deteriorate as quickly. So, those were the 3 points of the day in how to help your kidney. Again, this is Dr. Serrano with the tip of the day.